for Kenyans, and the promise that was made earlier on and where we are so far, and why this time is very significant as far as that journey is concerned.
Thank you. So universal health coverage has been a promise that has been made. It's a political aspiration as well as something that we hope will happen to realize Article 43(1)(a) of the Constitution in terms of the rights to health. So universal health coverage is basically an insurance scheme under which everybody should be able to access healthcare services based on pool financing. And that was the hope when we started this journey. And what was hoped and what was promised in 2017 in the elections was that we would reduce out-of-pocket costs by at least 54% and guarantee an essential care services package by 100%. So essentially what we should have is a package of services that you should be able to access free of charge at any given time. So at this point, you have universal health coverage pilots in 4 counties. And then we also have Makueni County on their own pursuing universal health coverage, which is possible for any county to do in a devolved system of governance.
Now, yes, continue.
Yes. And the hope with all of these processes is that with them running through, you should be able to see an increase of access to services for most people within a county. So the hope with any universal health coverage discussion is how many more people can you get covered by increasing, and then also how can you reduce costs of health going forward. So reducing costs of medicine, reducing costs of clinic visits, and then significantly reducing out-of-pocket costs that people experience. So out-of-pocket costs are usually one of the biggest issues. Most Kenyans are 1 or 2 medical emergencies away from poverty or bankruptcy.
Now, Ms. Were, we'll get into the details of what that would ideally look for the common Mwananchi. But then I'd like to throw this over to Ms. Nguku. Could you tell us, in your view, how we have done as far as that is concerned, and those pilot tests, in your view, have they been successful? Have they fallen short of the promise? How are we doing as far as universal healthcare coverage is concerned?
Thanks, Trace. I think I'll start by adding on to what Rima talked about.
Yeah.
In the
I think we have a problem. We apologize for the audio. Your audio seems to have an issue.
Really.
Yeah, we seem to have a problem with Ms. Nguku's audio. As we sort that out, I shall continue with that question. I'll just give it over to Ms. Were to tell us, as far as the specific pilot projects, pilot tests are concerned, how are we doing?
Okay, so the pilots were launched in the 4 counties, Kisumu, Isiolo, Nairobi, and I can't remember the 4th one. But the pilots were launched. The biggest issue, and I think I will speak specifically of Kisumu because we do a lot of work there, is priority setting. So one of the key things about universal health coverage is understanding that you can't cover anything. You can't cover everything. No state can afford to cover everything for everyone. So you have to have a discussion on priority setting that would set the stage for what an essential care services package is. And we saw this in Kisumu, whereby the discussions on priority setting or any discussion on universal health coverage started to happen almost 8 months into the pilot. So initially, people were just told to register. So register. But what they're registering for was not clear.
Okay.
What they're registering for was never disclosed in the beginning. And then only 8 months in, when they had the conference, is when they started to have discussions on priorities and what the government was going to fund. So it doesn't make sense, essentially, to have a process whereby you're asking me to come register, but you're not telling me what I'm registering for. So for the most part, for even that 8-month period, most people in Kisumu didn't actually understand what it meant to be covered under this scheme or this package. And priority setting is really important because you should be able to have this conversation across the board, not just as a government, but with citizens, so that you can at least agree on what are the most important things for you to cover, how you plan to cover them, to what extent. And once that is done, then there's more buy-in and there's less qualms. So that if we say, for us as people in Kisumu, because of the high HIV incidence in this country, we're going to essentially cover all HIV treatment and all care and support systems for people living with HIV,
right,
then they're clear from the beginning what that means when they enter into a clinic. However, priority setting has to be democratic. It can't just be the government. It can't just be citizens. It has to be very many different facets of people discussing this. And in that process, you have to be able to be honest about available resources, current trajectories of disease, how the epidemiology is going,
yes,
and what needs to be taken care of to ensure that you have a healthy nation going forward.
Okay.
And this is a process that we've done poorly, inconsistently, because a lot of our discussions on universal health coverage have been focused on curative medicine. We haven't discussed preventive medicine or promotive medicine. So things like community health workers aren't really catered for within these discussions. Things like having preventative measures. The only thing that we discuss extensively is vaccination for children. But preventative measures across the board for things like cervical cancer, where you could have HPV vaccines being discussed more robustly. We don't have those discussions as a country. And that's become more difficult, such that we're only going to focus on building hospitals, having medicine in place, but not preventing people from getting ill, which then gives us higher costs going forward.
Okay, Ms. Nguhu, I'm hoping your audio is better now. Could you chime in on this, on how we are doing with the pilot project?
Thank you. I hope you can hear me now.
Yes, yes.
Yeah, I think one of the things, two other things that were really left out by the promise of UHC was the element of equity. And the whole aspect was about the principle of equity is around going fast to the farthest, ensuring that those who are already far are already brought closer to, it's not about equality, it's about equity, ensuring that you first start with the ones who have been left out for quite a long time. That was never done by the pilot. Two, the other aspect about quality of care. Quality of care, and I'll talk about this from the area that I know best, that is maternal health. 9 out of 10 women in Kenya today die as a result of poor quality of care. And that is a report that was released by the Ministry of Health in 2018 that showed that women who died between 2014 and 2018 died as a result of poor quality of care. So the principle of quality, and quality not just as defined by the supplier, the government, or the health institutions, but as citizens, has always been a far-fetched dream. And that has really not really been achieved even by the pilot that went on. And then the other aspect that Nerima has touched about people-centeredness, the discussions and whoever was shaping the discussion of UHC left out the key stakeholder. 90% of the people who are supposed to be on the table as stipulated in the Constitution was actually the citizen. Right. But in talking to people from these counties, what they have told us is that we were never consulted. We were just told, do this, register for this. We saw health facilities being built, but going to those health facilities, no health workers, no clean water, no medicines and supplies. And this is, I think, that is why we are finding ourselves in where we are now, where counties are planning to down their tools, but no one is consulting, no one is caring about. In the midst of a pandemic, how can we be thinking about this? Where is the common person who is supposed to be taken care of?
Right. Yeah. Now, ideally, let's talk about reproductive health care. What difference would it have brought about if it was rather rightfully implemented with the right kind of consultation? How would a mother who's expectant go through the medical services in a different way, or approach certain illnesses that surround reproductive health in a better way than what is happening right now?
Okay, let me start by saying that I think as a mother, the first thing that you want to do when you get pregnant is to ensure that throughout the continuum of pregnancy, you are well taken care of. You go to a health facility, you find a health worker who is respectful enough, you find all the supplies, you get the right information, you get prepared well for your baby, and when the time comes for delivery, you want to deliver in a clean environment, clean hospital, you want to get the right food, you want to have a good experience. But imagine if 9 out of 10 women in Kenya today are not able to accessing poor quality of care or are dying as a result of substandard care. What does that mean? I'll take you back again to 2017 when a report was released that Kenya was part of, that actually by the Lancet, that one of the reasons why women are dying in health facilities is because of poor substandard care. And as a result, UHC was supposed to come in and actually ensure that it embraces the aspect of quality. And quality not as defined by the player, the giver, that is the government or the health workers. Because when we look at quality as defined by the health worker. You talk of the policy maker, they will think about when I construct a very sophisticated dispensary, then that is quality to the woman. But then again, in last year, we went out and asked women in a campaign that we done what women want. What is your topmost request for, what does topmost quality care look like? And the women and girls told us that for them, quality of care means respect and dignity. When I go to a health facility, I want to be called by name. When I go to a health facility, I want to be given the right information. I do not want to be slapped.